Your health, my health, is your responsibility. Your health, my health, is my responsibility. Today, we are having real talk, real conversation, which is going to have real impact to your life. So please help me welcome our guest today, ambaye atajiintroduce, atuambie anaitwa nani, and he's going to pray for us, then we begin and continue. Welcome so much. Karibu daktari.
Thank you so much, Mr. Peter.
Yes, welcome.
Asante sana. It's a great pleasure and a real honor to be on your show.
Okay.
So that we can address a few matters that relate to healthcare and why it is important for everyone to take their own responsibility as pertains to matters health. So I'm looking forward, I'm excited, I'm looking forward to the conversation we're going to have.
Yeah.
I'm looking forward to also taking up any questions that arise from the viewers. And I'm sure at the end of it, God will be glorified.
Please help us pray. Then we continue.
Let us pray. Dear Heavenly Father, we come before you this afternoon. We thank you for the gift of life. We thank you for the opportunity to be here, to minister to your people through this way that you have given us. We thank you for our viewers as they also listen and partake what we have for them, and as they voice any questions and any health concerns that they might have. We pray that we shall be able to bridge the gap of healing through your hands, through our hands, from your will, O God. May bless us, walk with us in this show. In Jesus' name we pray.
Amen, amen, amen. Please introduce yourself. Somebody amesema labda watu wanajuana.
Yes. So my name is Dr. Patrick Mugonya KIHIU. I am a general practitioner and I work with Royal Care Hospital. We are located in Roysambu along Lumumba Drive, and we offer a wide range of healthcare services, from consultation to lab services to maternity to inpatient to theater, and also dental services. We offer a wide range of services. Yes. So that is who I am.
Watu wa Roysambu. Muko na mutu hapo. Thank you so much, Dr. Patrick.
Thank you.
This is the data ambayo niko nayo, that in Kenya we are having over 17,000 over. Now that does not mean there are many doctors. Saying over 70,000, we are approximately 18,000. Let's give it 18,000. Now, according to that, we are having the general practitioner like you. We are having, out of that number, specialists. We are having foreign doctors coming to our country just to help us. WHO cites that one doctor should be able to attend to 1,000 Kenyans.
Yes.
But in our case, we are more than 50 million population. That would mean one doctor is serving over 2,000 people.
Yes.
Why this? And we are having so many graduates in medical field. Mbona hii sasa?
To answer your question, Bwana Peter, it's a challenge that we have, not just in Kenya, but it cuts across the world, and especially in the African setting. The doctor-patient ratio has always been low. The number of doctors that we produce each year, when you tally that and you look at the population, the way it's also increasing, it poses a big risk. It poses a big risk that we might never really get to bridge that gap. But because if you look at that data, it means that now one doctor should, WHO recommendation is one doctor should serve a reach of about 1,000 patients. But currently we are at about 1 to 2,000, 3,000 there. So it's a big challenge globally. And we try to bridge that gap in, you see, now importing maybe healthcare workers from externally from other countries as well. And also by also employing other cadres of healthcare workers like clinical officers, nurses, to bridge that gap and reach where doctors are not able to reach. Exactly, because that is a big challenge and it has always been there. And I don't think in the near future we are going to bridge it. We have to use other means.
Let's make this conversation very foundational.
Yes.
And why do we need a health insurance?
A health insurance, just like any other insurance tool. You see, insurance is pooling of risks. We pool risks, maybe 10 of us. We all contribute 100 shillings, and we have 1,000 shillings now in stock. Then one of us needs 50 shillings. You know, it is easy. It is easy, or maybe they need 500 shillings. It's easy for us to, through that pooling of risks, it's easy for now them to be sorted through our, we have mitigated that risk, yeah? So health insurance is a tool that helps people, you, through your small contribution, be able to access even greater health intervention. And that is why it is recommended for people to take up health insurance. It is a very important financial tool because it protects you from, for example, if you pay a bill, a health insurance bill of 50,000 per year, you might find that you have a coverage, health insurance coverage of about 5 million. So should you need that to take up that 5 million in terms of health bills, you will have been covered by your 50,000 shillings. So that is why it helps you avoid that distress when now that time comes and unfortunately you need that service. That is why health insurance is a very important tool.
Actually, kuna michango mingi kwa WhatsApp, kwa nini, because people are in need of resources to take care of their patients, of their relatives, and it is a need. Now, kuna mtu aliniuliza, mbona kwa hospitali ukosangi Panadol, Brufen, Paracetamol?
That is true.
Mbona, by the way?
Haikosangi kwa sababu, you see, many diseases present with very general symptoms, headaches, fever, and all these things. So paracetamol, for example, by virtue of being analgesics, we call them analgesics. They have usually three functions. They usually reduce your fever, they reduce pain, and they reduce inflammation, which are common characteristics of most of the diseases that we have. So they are good, what I can call in quotes, first aid tools before you're now investigated further and managed now as per the condition that you come with. So before now all that happens, we need to at least bring down the pain, bring down the fever, bring down the inflammation before we investigate further and we're able to manage that particular disease. That is where you find paracetamol, Brufen, these analgesics. That's where you find them in most of our healthcare setups. They're very important tools for basic first aid.
Okay.
Yes.
Oh.
Yes.
So, sir, what are the major causes of many diseases now that you have been into medical field?
Yes. So diseases, most of them are usually caused by, we can now classify them into maybe communicable and non-communicable diseases. Yeah, communicable diseases are the ones that you transmit from person to person. So those are your common flus, such things. Yeah. Basically day-to-day interaction with people. Humans are social beings. So that is where mostly communicable diseases come in. And also we have non-communicable diseases, things like your hypertension, diabetes, which are now largely maybe contributed to by genetics. Also environmental exposures to things we call carcinogens. For example, now those ones cause cancers. The things that are found in diets, things that are found in maybe carbonated drinks and all these things. So it's a wide topic, but generally those are the causative agents. When you classify them like that, those are the causative agents of diseases.
Okay.
Yes.
Let's go. We have patient A, ameambiwa ameenda hospitali and amekuja kwenyu. What is the procedure of investigating a disease so that one, you do not give a wrong medication to a patient?
Yes.
Yeah.
Okay. So when a patient comes to a facility, like to us, they've come to Royal Care Hospital, the first thing is you take them through a registration. You need to take their biodata because you need to understand a person. You need their details so that you also don't give their treatment to someone else. So
biodata to me, for somebody who is following that.
Yes. So biodata for our viewers, biodata is a patient's name, the gender, the age, and those unique characteristics that everybody has as per the way we also register people like nationally. So that is what we call the patient biodata. Your name, age, gender, where do you come from, your occupation as well, because all these things can also help us pick out a few risk factors. Like you might find that some diseases are more prone in certain regions over others. Yeah. Also, age is also a factor for some diseases as well. So some occupations might also put you at risk of certain conditions more than other people.
Okay.
So that is very important for us to have your biodata when you are registering you. The other thing is called clerkship. Clerkship, for our viewers, is the taking of information that you have told me that you have, what brings you to hospital today. So you have told me that you have a headache. So I need to understand, where is this headache? There are regions of the head that we call now, this is frontal, this is occipital, this is, we have regions of the brain. And all those have causative factors.
Okay.
So we first understand that you have had a headache. Did it start today morning? Has it been there for a year? Or rather, maybe you have a cough. Is it productive? Productive is iko na kikohozi, or is it a dry cough? All these things we're able to categorize. Now, are there any associated symptoms? For example, have you lost weight? Have you, does it come with night sweats, for example? Now, if a patient ticks these boxes, you're able to categorize them. Are you dealing with a common cold, or are you dealing with something like tuberculosis? So that is now the next stage. It's called clerkship. And we usually say in medicine that good clerkship gives you 80% of diagnosis.
Oh.
Yes, just listening to a patient and asking the right questions, and also examining that patient, that they have told you that they have chest pain or difficulty in breathing. Take a stethoscope like the one I'm wearing right
by
now.
Yes, how does
the stethoscope,
it function?
like what?
How does it function?
Ukiweka kwa masikio, when you put it in your ears, you're able to, this part is very sensitive. It's called a drum.
Okay.
You're able to place it on a certain organ or a certain part of the body, and you're able to hear intrinsic sound, ile sauti ambayo iko pale ndani, and you're able, there is what now we can tell, there is what we're able to judge and be able to like pick out certain signs in someone. Yeah. So as I was saying, good clerkship and examination. Vile unaona daktari amekwambia lala kwa hii kitanda, and they're able to palpate, wanaweza kuguza hapa na pale na ili waweze kubaini nini ambacho kina kuuguza, and it helps us pick out 80% of the problems before we even send you anywhere else. So to answer your question, the patient has been registered, we have taken good biodata, we have taken good clerkship notes, we have done a good physical examination. Now from there we usually get something called a provisional diagnosis, that there is already a list of 2 or 3 or 4 possibilities of what you're ailing from. So now I can choose to send you maybe for imaging, or to lab, or maybe to now a further investigation to confirm one of the 3 or 4 diagnoses that I thought about when I took good notes and I did a good physical examination. So that is how we arrive at making a good diagnosis, and then now we can discuss treatment.
Why does it take long to get those results?
Long is relative. Long is subjective. Yeah, because we have in a facility, we have a test that takes seconds. For example, for you to have your blood sugar, random blood sugar taken, it's just a prick of the finger. We run it on a small machine called a glucometer, and you get your results within 5 seconds. But we have other tests, for example, that even have to be taken to other countries for you to get. Yes, we sometimes take samples in Kenya, and we're able to send to other countries because maybe our country does not have equipped labs to run those tests.
Give us a sample.
We are still there.
We don't have those machines?
Yes, you might find that is why you see patients maybe, for example, going for treatment in India, in South Africa, in England, and the like, yeah? But we're making very good strides. But maybe as a country, maybe we are not there yet. Some samples have to be taken and maybe done in another country. So it's quite a range of logistical challenges. But even in our labs, some tests you have to wait, maybe the instructions say that you wait for 30 minutes. You've prepared a sample, but you have to wait for 15, 30 minutes before you can actually run it on a machine. So tests take a wide range of time, and it's subjective. So it can take seconds, it can take weeks to get results back. It depends on the test that we are investigating and how long each test usually takes.
we have levels of hospital, level 4, level 5, going up there. My question is, what determine the level of a hospital? Yeah.
Okay. So that is regulated by the Ministry of Health and also by the Kenya Medical Practitioners and Dentists Council. So there's a list, there's a checklist that you have to fulfill for you to be categorized in a certain category of hospital. The list is long. The list is very long. You can, now depending on the number of staff that you have, the services that you are able to offer, what are the qualifications of your staff. For example, for you to run a level 3 facility, there needs to be a medical officer or a general practitioner like I am. So a facility at Rokia Hospital is a level 3 facility. For you to maybe run a level 4 facility, you need a certain number of consultants, you need a certain number of inpatient beds, you need a certain level of capacity to do some certain investigations like maybe radiology, X-ray machines and the like, yeah? So it is a list that is usually issued and regulated by both the Ministry of Health and the KMPDC. Yes.
Why is there a need that we have regular checkups? You go to a medical facility, you are not sick, but you want just the medical checkups.
Okay. There's a big need for us to have regular medical checkups. One and the most important is if there is an upcoming problem, we can be able to pick it early enough and intervene early enough. For example, let me give an example, a very basic example of how we are able to diagnose cancers and manage them as well. Yeah, if a patient comes early to a facility, we are able to pick out, maybe just doing a random well-man or a well-woman clinic. Yeah, we're able to pick up maybe a certain tumor that is growing somewhere, and we're able to tell that this one is we investigate it further and we see that it is an upcoming cancer, or it is already a cancer, but it is in the early stages, like let's say stage 1 and stage 2. Stage 1 and stage 2 for most cancers are manageable and they resolve completely, maybe through radiotherapy, chemotherapy, or surgery. But if a patient comes, maybe they have not gone for medical checkups, and they come maybe to the facility maybe due to weight loss or other symptoms, other more like complicated symptoms, and maybe we investigate and we find out that their cancer is more advanced, maybe stage 3 or stage 4, then we are not able to intervene much. So that is why it is important to do those, early diagnosis by the patient coming early to us through those regular medical checkups. Yeah.
How often should it be done?
It is recommended that we all do, young and the old. It is recommended that we do these tests once a year, at least once a year. We do something called a well-man for the men or well-woman clinic.
Oh, well-man for the men?
Yes, and well-woman clinic. Okay. We do a random, we look at maybe your blood level, we look at if maybe you have any infections, we look at your sugar levels, we look at your BP, we look at probably do a scan. We look at, for men, maybe we do things like prostate assessment, such things, yeah? So for women, we look at maybe do you have any masses that are growing around your uterus through a scan and stuff, yeah? So that is why it is important for us to do this well-man and well-woman clinic.
Is it at a cost in our general hospital? Yes,
it comes at a cost, like any other thing in this life. Healthcare comes at a cost. But it ranges. It ranges okay. From facility to facility. It ranges, and also based on also the scope of the investigations being done. Exactly. Yes.
Lifestyle choices that can compromise a person's health.
Yes.
Give us a sample.
Yes. That's a broad, very broad question.
Okay.
But I'll answer it to the best of my ability. So lifestyle choices, first of all, humans are very social and very dynamic beings. So to the extent of they'll ask you, who said that this is a poor lifestyle choice, this is a better lifestyle choice. So it's a very subjective question, yeah? So to answer your question to the best of my ability, yeah? Their lifestyle choices that predispose people to certain conditions. For example, living a sedentary lifestyle. Sedentary lifestyle is the lifestyle where people do not have any activity. You do not exercise, you do not walk, you do not do all these things. They have been proven to cause some conditions, like what I was talking about, non-communicable diseases. They predispose you to things like diabetes, hypertension, and the like. So that is a lifestyle choice, you see. So we always recommend exercise. We usually say 30 minutes, at least 30 minutes, 3 times a week.
30?
Get active 30 minutes, 3 times a week.
Okay.
You know, just that is a bare minimum. But if you can actually go to the gym or work out or have some sort of activity day in, day out, you'd actually live a very healthy lifestyle. We also have other lifestyle choices, like indulgence in alcohol, in smoking. These things have been proven to also predispose to certain conditions. They damage some of your vital organs, like your liver. Smoking damages your blood vessels and also your lungs as well. So you see, that's a lifestyle choice as well. We also have to talk about, I was watching a documentary at one of our local stations as well. They did recently about the reckless engagement in sexual activity by the young people. That's a lifestyle choice as well. So it predisposes them also to disease. And I thought they did a good job on enlightening our young viewers about that as well. So that is how lifestyle choices usually affect, it's a causative for diseases as well. Yes.
We are up and down, looking for resources just to sustain life.
Yes.
Rest. Does it help in controlling a person's health?
Yes, rest is actually a very important thing when it comes to controlling and helping someone avoid diseases down the line. For example, yes, I understand that we all have to wake up. Nasamanga pesa ndio inatutoanga kwa kitanda asubuhi. Everyone is in there, you know. We all want to make a good living. So I understand why people have to do what they do. But it is important to incorporate rest into our routines. Rest has been shown to reduce the chances of things like mental diseases, like stress, which also down the line leads to things like hypertension. So incorporating rest helps you avoid such, causative agents of other diseases, and also that mental well-being. When you incorporate rest, you also have better mental health outcomes because you're able to debrief. You're able to have that moment of debriefing and, just letting your faculties reset to a mode where you can be able to go again, to push again.
By there, is burnout a disease?
Burnout is when you think about it, it's subjectively subjectively a doctor can assess you, see that all you're suffering from is stress or burnout, and actually recommend a bed rest for you, and it will do you a whole lot of good. So when you look at it subjectively, it is not in we usually look, there's a scale that we look at our diseases called ICD-10. So it is not listed as a disease, but when you look at it subjectively, and something that requires intervention from a clinician, then you can look at it as a disease in quotes. So burnout is not a healthy thing.
Kuna kitu umesema chemo and radiotherapy.
Yes.
What's the difference?
The difference is chemotherapy is drug. So we usually give either drugs to swallow, or we inject some drugs that help you manage maybe a certain cancer. Radiotherapy is using radio. Radio is radiation. So we use rays. We use rays to achieve the same goal. Maybe attack a certain cancer, some harmful cells. Yes.
What are terminal diseases, and how should we protect and prepare for them?
Terminal diseases, terminal diseases are health conditions that are expected to lead to death. Yeah, we have to say it bluntly. So terminal diseases are health conditions that are expected to lead to death. Let me tell you, Bwana Peter, In the health industry, we usually say that death is a part of life.
Okay.
Death is a part of life, and this is what leads us to this. Biblically as well.
Yeah, sure.
We have Methuselah, who lived in this world for 969 years.
Yes.
Where is he now? So death is a part of life. Noah also lived, we think, about 900 plus years as well. Yeah. So death is a part of life. And if you look at our hospitals, most of them, among their fine print and their motto and everything, one of their goals is to give a dignified death. That somebody passed on while we as healthcare workers were doing our best, because death is going to come eventually. But where I come from, there's a saying that I can loosely translate to: even when someone is old, losing them is still very painful, because we are human beings.
Yeah, true.
You know?
Yeah.
We usually say, where I come from, we say,
yeah.
So despite someone, you know, might not be a parent literally, but even a grandparent, great-grandparent, even when they are 100 years old, you still want to see them a bit longer. So I'm narrowing down to a statement I want to make, yeah?
Yeah.
I'm narrowing down to the statement of, you cannot really prepare for death. You cannot really prepare management of terminal diseases. So what we usually do is giving what we call good psychosocial support. Psycho is mental support. Mental, and socio is social support.
Can you make it very practical?
Yes.
Mtu amekuja hospitali.
Yes.
You have done your medical checkup.
Yes.
Realize that this person
yes.
akona leukemia.
Yes.
And you know, imefika stage yenye
yes.
as amekosa kuenda hospitali before,
yes.
labda akapuzilia, ama aliambiwa na friends na relative, akaona kama it is manageable.
Yes.
But akakuja ukaona this is now is a terminal disease.
Yes.
Now take us through huyu patient amekuja kwako.
Yes.
Yeah.
It is not easy, Bwana Peter. It is not easy.
From your side, even as a medical practitioner?
Yes, even as a medical practitioner. Of course, we have some training in how to handle these cases, but it is not easy. And it is case-to-case dependent. You might find nowadays patients are very informed. So by the time they're coming to you, they have already Googled and they know the outcome, the potential outcome of what we are dealing with. Yeah. So that makes it a bit easier, because now giving them that information, they already expect it. You have to give it in a professional way. We do things called family conferences, where you sit the patient down together with their next of kin. You do not disclose. There's something called doctor-patient confidentiality. So you do not disclose this information to everyone, to their whole village. It is just them and maybe their appointed next of kin. Yeah. So you sit them down in something we call a family conference, and you're able to explain to them that now this is what is happening in this person's body. And given that maybe, for example, someone has a certain disease, maybe a cancer that has spread to the brain, for example, or to a vital organ like the liver, and there's no way you are going to remove that organ and also remove the brain in the process. So it gets to a point where there's nothing that is humanly that can be done in human capacity. There's nothing that doctors can do. There's nothing that no one can do. So you have to break down this information in a professional way. It is not easy, as I said. I have to repeat that it is not easy. But you see, now we have to give that cycle, and also the family, the next of kin, the people around that particular patient. You also train them, and you also try to give them tools to be able to manage these patients at home or maybe in the ward. Give them that social support, encourage them. Dealing with the patient directly, you ask them to, you find a professional way to, ask them to get their house in order. You have to tell them in a way that now this is where we are, Mr. So-and-so or Mrs. So-and-so, and this is what is going to happen. This is the prognosis. Prognosis is weighing how long, from studies, weighing how long this person has to live, given the stage of their disease, and also from your professional experience.
You tell them
exactly
in their eyes.
It is quite difficult, but we have the tools to do that.
Now, Daktari,
yes.
Before we continue, you would help us know in your facility, what kind of diseases can you handle?
We deal with a wide range of diseases, yeah?
Okay.
As I said earlier, it is easy to classify them into communicable and non-communicable diseases. So we deal with day-to-day issues. We have your common colds, you have your infections here and there, you have dermatologic conditions. By virtue of being a general practitioner, we can see patients across all disciplines. By all disciplines, I mean that we can see pediatric patients. Pediatric ni watoto.
Okay.
We can see adults as well. We can see a bit of surgical cases. We can see maternity cases. We are licensed and we are allowed professionally to manage all those conditions.
Okay.
Yes.
Oh, thank you so much.
Yes.
In case somebody may be having a question specific for you,
Yes.
anaweza angalia namba iko kwa screen, ndio hiyo hapo hapa ndio hiyo 0727 863-292 ama 0799-234-943. Unaweza WhatsApp daktari and anaweza kujibu vizuri. Now, umetuambia ya kwamba if somebody has a terminal disease,
yes,
you take them through the psychiatrist and be able to help them understand that how long that this disease,
yes,
ama atakaa nayo,
yes,
kisha tumuage. It is so unfortunate. That's why tumesema it is good to go for medical checkups.
Yes.
Na umesema kuna well men na well women
clinics.
No,
yes.
Nashika.
Unashika.
Now,
very good.
Effects of drug abuse.
Yes.
Are there effects? Because mumekuja kwa hospitali, you have realized kuna so many young people who are using drugs, and not only young men, and even the millennials and everyone.
Yes.
Unapata mtu anavuta sigara kutoka asubuhi mpaka jioni, one after another. Watasaidika?
Bwana Vita, the effects of drug abuse, there are so many, because there are so many things that are classified as drugs.
Okay.
So there's nothing, what I'd say is there's nothing good that comes from, these drugs of abuse. Yeah, they predispose to a wide range of physical and mental issues. So we actually say that drug abuse is the leading cause of mental illnesses in Kenya, in our setup. So on the mental side, it reduces somebody's potential, somebody's day-to-day functioning. It predisposes people to addiction, and addiction comes now with, you need more of that drug to stay functional. So also cost implications. It predisposes people to also conditions like depression, and physically, things like now alcoholism predispose people to organ damage, like liver damage. As I said, smoking also predisposes people to a wide range of lung diseases and also blood vessel diseases. So there's nothing good that really comes from drug of abuse. So it really plays a negative impact on our society's health.
Okay.
Yes.
Mbona mnakuanga na handwriting mbaya na kwa shule mlikuwa mnaandika na handwriting nzuri?
I would say I'm laughing because I have seen doctors and healthcare workers being trolled a lot about that.
Okay.
There's no particular answer, because when you look back, a majority of healthcare workers were excellent in inches and compositions, and they had very, very good handwritings. Yeah. So I don't know where we lost it along the way. I don't know where we lost it. Whether we lost it in training.
Okay.
We became good at using scalpels and knives, but we lost it with a pen. Yeah? So there's no particular reason why we are not good at handwriting. Yeah.
Okay.
But it's actually something that doctors are urged to do, to be be very legible in your handwriting, so that people taking your instructions, could be the nurses, could be pharmacists, so that they don't misdiagnose, mistreat, they don't give the wrong drug perhaps, or give the wrong information to a patient because they could not decode whatever it is that you had written.
Something interesting is, sisi hatuwezi kusoma hiyo handwriting. Nyinyi mnaweza. Why?
I think a lot of healthcare workers deduce from context.
Okay.
For example, there's a patient who is coughing, and maybe they have seen that there's a drug that starts with, maybe the pharmacist has seen that there's a drug that starts with A, and it is being given at a certain milligrams and for a certain duration. Maybe from context they deduce that this is probably a certain drug.
Okay.
Maybe they see, maybe a patient has a fever, and they see that there's a drug that starts with P, and it has a certain dosage and it has a certain duration. Maybe they are able to deduce that it is paracetamol. But it is always recommended that even as healthcare workers, you should always confirm. If you're not able to read something very well, the best practice is to confirm from the prescribing doctor. Just give them a call, reach out to them, and confirm that that is the exact drug that had been prescribed, so that you do not give the wrong thing to the patient, which would be come with very adverse effects.
Okay.
Yes.
When do you refer a patient to another doctor?
Okay.
Yeah.
So referral is part of patient management. Just the same way a doctor can give you paracetamol. That is management of a patient. Referral is also part of management of a patient. So you refer a patient when the resources or the knowledge that you have cannot be able to give the best care to this particular patient. So you need someone more skilled, you need someone more trained, someone with more experience, or a facility that has better resources to manage that particular patient or that particular case. That is when you refer a patient. And it should be done as fast as possible. Once you make a diagnosis or a provisional diagnosis, as I mentioned before, provisional diagnosis is your suspicion that this could be a certain case. Refer as fast as possible so that this patient gets the best care and within the shortest time possible.
Okay.
Yes.
Ni kesi gani umeipatana in your medical practitioner ukasema hii ni moto?
I have practiced medicine now for about 11 years.
Okay.
So I have seen a number of cases that have quite been challenging to manage. Yeah? But I once worked in a facility within a rural setup, and every case that came and required higher attention, maybe to be referred to a consultant or a bigger facility with more resources, every case came with its own challenges. Because, for example, getting an ambulance in a remote region, sometimes you had to wait 3 or 4 hours for you to be able to send to the next level of care. So for you, having a patient you cannot manage for 3 or 4 hours always comes with its own challenges, because you're the one answerable for their life and you do not have the luxury of resources. So those are countless number of times that I can say that happened.
Is it the reason that was it the reason behind you starting your own personal hospital?
Yes, that was the biggest motivation.
Okay.
Because I identified gaps in healthcare management in the country, and now I purposed to try and resolve some of those gaps that we see. So at our facility, we actually have very short turnaround times.
Okay.
From registration, you do not have to wait 2 hours to see a doctor. When a doctor sees you, you do not have to wait another 2 hours for you to be given the treatment that he has prescribed. So we have the shortest turnaround times when you come to Royal Care Hospital.
Medical inakuanga expert. Who determine the cost of medication? Is it the doctor?
Yes.
Is it KPDC? Who determines?
Yes. Bwana Peter, I'd say healthcare, in as much as healthcare practitioners, we usually say that it's a calling. Practice of medicine is a calling. But just like any other thing in life, comes at a cost. You know?
Yeah.
We have to buy the medicines. We have to pay our rent. We have the facility rent. We also have our own things that we have to do and aspirations. So just like any other thing in life, it comes at a cost. And sometimes the technology behind it, the efficacy of the drugs that we give, they come at a premium as well. Yeah. But the cost of healthcare is usually determined by the government, the regulatory bodies, and also the Ministry of Health. Yeah. So KMPDC and Ministry of Health work hand in hand to give guidelines about how much you should charge for certain services that you're offering, and also the rates at which you can do certain procedures and also sell certain drugs. So you'll find you cannot come to me today and tell me that you have a cold, but I decide to charge you 1 million shillings for consultation. So that is regulated, and the patients and consumers are protected by the regulatory bodies, that is the KMPDC, Pharmacy and Poisons Board, as well as the Ministry of Health.
Is the information available to the general public?
Yes, that should be general information available to the public, but I think you might not find it on every notice board, because just like all other professions, there are things that are usually, you know, if you dig for that information, you will find the information, but I don't think it is displayed on every public, you know, every public notice board that you come across.
Oh.
Yes, but it is public information.
Okay.
Yeah.
Tukifika Roysambu, where is your specific location of your hospital?
We have a road called Lumumba Drive. So on Lumumba Drive, coming from, let's say, Thika Road, once you join Lumumba Drive, about 100 meters from the junction,
okay,
we are on the main road.
Oh.
Yes, we're on the main road, and we welcome any person with any consultations. We are there, and we have very short turnaround times from the minute you walk in to the minute you're seen, the minute you're investigated, and the minute that you're discharged. Yes.
This issue called mental health, what about it?
Mental health is, the more humans evolve, the more we are also coming to, you know, recategorize mental health and even go deeper. If you look at maybe in centuries ago, we did not have all these classifications of all these mental health problems that we have right now. So I think we're making very good strides in diagnosing, categorizing, and also managing mental health issues, but they are very important. That is why doctors of, let me call them Gen Z doctors in quotes now, they are coming and offering now what we call holistic approach to healthcare. That just because you have a headache, or maybe you have fatigue, you have some body aches and fatigue, we're not just looking at it medically. We're also looking at it from a holistic, could you be stressed? Could you be undergoing depression? Could you, you know? So the holistic approach to healthcare means you're not just treating the physical signs and symptoms that you're seeing. You're looking beyond that. That are there any mental issues? Are there any social issues that you can intervene? That is what we call holistic approach to healthcare. Oh. And it helps a lot in diagnosing and managing mental health issues as well.
Are we finding this as something that can be managed by people? Ama, do you, like, when somebody comes to your Royal Care Hospital,
yes,
would you refer somebody to a psychiatrist instead of giving them medication? Ama, what do you do?
Yes, Bwana Peter. The biggest prong in management of mental health issues is what we call psychosocial support. Psychosocial means understanding, going into this person's mind, trying to understand what it is exactly that is ailing them, as opposed to giving those drugs. You will give, most of these drugs that are given are meant to suppress their brain activity, because most of these mental issues come with hyperactivity of the brain and excessive release of certain chemicals in the brain, which I won't go into detail. So instead of just giving them drugs to lower those hormones being released and all these chemicals, it is best to address the causative reason why they are coming. So that is why you dig deep into their brain through psychosocial support. Psychosocial support is literally just talking. So send them to a therapist, send them to a counselor, send them to a pastor. You might find that these things are manageable even without giving chemical agents, now what we call the drugs.
Okay.
Exactly.
Oh,
yes.
Wow, nice.
Yes.
In your area,
yes,
of expertise,
yes,
umeipatana na patient, umemdiagnose, ukafanya check up, ukarealize,
yes,
yes, anasema ako mgonjwa,
yes,
na unaangalia anasafa.
Yes.
Then all of a sudden baada ya kufanya check up, ukaona
yes,
nothing that is coming,
yes,
but he's claiming ako in pain. Na wengine wanasema it is a spiritual attack. Now that you are
yes,
a Christian,
yes,
in that medical field, do you pray for that person? Ama unawarefer to a pastor? What do you do?
That's a very good question.
Yes.
Because as I said, as we evolve, more and more of these cases are coming.
Yeah.
What I would say is this. Yes, as I said, we are trained in managing these mental health issues and also conditions that you really cannot pinpoint at what the problem is exactly. So once you diagnose that this is probably a mental issue or a social issue, there are experts to deal with that. As well as sometimes someone might come, they are too stressed, and the causative agents are things that need to be prayed for. So you do your best. As a Christian doctor, you can pray for them, you can give them psychosocial support. But if that does not work, refer them to a specialist in that field now. You can link, a specialist at that field could even mean your local pastor. Could even mean your local pastor, because it could be they need also spiritual healing. So you assess the situation, see if you need to send them to a psychiatrist, see if they need a social worker, see if they need a pastor. But all in all, we have the basic training as doctors and as healthcare workers to deal with quite a wide range of cases.
Cases of abortions are rampant in this Kenya.
Yes.
And medical practitioner,
yes,
they are facilitating that.
Yes.
What would your take about it?
My take about it is, yes, as you said, they are on the rise. Those cases are there where you see healthcare workers are giving, and all ranges of healthcare workers, they are giving these drugs, maybe to make some extra coins or just for maybe lack of a certain degree of morality. My take is this on the matter. Spiritually, this is denial of right to life. So someone has to take a moral high ground and refuse to engage or offer those services. But it comes from an individual. It's you as an individual, you as a healthcare worker, if you're a Christian doctor, do not engage in such activities. The second prong is legally. It is illegal within our laws to induce abortions. So it could also land someone in trouble, in legal trouble. So people should refrain from it. Yes.
Run away.
Yes.
Oh, wow, wow,
yes.
wow.
Yes.
How did it take you to study medicine? Why didn't you do engineering? But he's from Nyahururu Elite School. He scored a good A minor.
So I've always been passionate about medicine. So it was always a dream growing up. But it was a long time ago. It was a long time ago when I was making these decisions to get into it, yeah. But of course, yes, I found that now I had qualified, I had the grade, I had the marks, and I would like to send a big shout out, if you allow me, to Elder KIHIU and Mom Nancy. Those are my parents, and my Dr. Eric KIHIU is my younger brother, for the encouragement to get into it. So my family played a big role to encourage me to get into it, since I had already qualified. And now I got into medicine. I studied medicine. I started studying medicine in Kenyatta University in the year 2009. So I got in. I was a 16-year-old young man, I think, at around the time. So I got in, studied for about 6 years, and I was posted now for internship. So I got into it. It's not easy. It's a very, very long course. Yeah, so that's how I got into medicine. I got to train. I took 6 years. Then I was posted for internship. Another 1 year of now hands-on training. So I finished internship in 2016, and I was licensed now by KMPDC. And now I took on the mantle.
Wow.
Yes.
Tune in from ICD, yes. KPA, Embakasi. Thank you. Tune in from Kiambu. Tune in from... Oh, thank you so much.
Yes,
thank
yes.
you so much for our people.
Yes.
Ambao wanatufuata. What will you tell parents who have children in their bringing? Unasikia mtoto, I want to pursue medicine. I want to pursue medicine. Yes. What will be a word of advice?
Yes, my word of advice would be encourage them and push them to take the course, because it is a rewarding cause. It is a very noble cause. Anywhere you go and you mention that you're a doctor, you're treated with certain regard and certain esteem. So I would encourage parents and guardians to mentor their children, and especially if the child has the will and they want to pursue the course, encourage them, make sacrifices. As parents, people have to make sacrifices for, it's a very expensive course.
It is?
It is quite expensive to study medicine, even locally and also abroad. But if you can make that sacrifice and make sure your child goes to school, if they are interested and also they qualify, I would advise parents and guardians to make that sacrifice and let their children study.
To our Gen Zs who are still doing the training,
yes,
what will you tell them?
I would like to encourage them and tell them that it is worth it. The course is worth it. To keep trying, to keep working hard, and eventually it is going to pay off. I would like to encourage them.
What has been your main challenge as you practice your course?
My main challenge as I practice my course is probably, I'd say, maybe lack of resources, especially since I have worked in the public sector for quite a while. Lack of resources. We are not as advanced as maybe Western countries. We are a trying country. So sometimes you find that maybe you're in a rural, remote setting, you don't have the right tools, right appliances, and you need to make certain interventions to a certain patient. So that has been the biggest hurdle, because you have to improvise. And unfortunately, if it doesn't work out, if it works out, you become a hero. If it does not work out, you become a villain. Because now they look down at you and they ask you, Daktari, what were you doing? You know? So that has been a big challenge. I've seen also colleagues go through similar challenges in low resource settings. And if it doesn't work out, now they are crucified for it.
In your hospital, do you offer internship opportunities, training?
No, we do not offer internship opportunities because that requires a higher level of institution. As you said, the categorization. Because now when a healthcare facility is offering internship opportunities, it means it's now a training facility and perhaps a referral facility as well. Exactly. So it needs to have consultants for every discipline. There are certain things that it needs to certain criteria it needs to meet for it to be a training facility.
Something that people do not know about health that they need to know?
So something that people need to know about health is that healthcare, it should be your priority. Actually, your health is your own responsibility. As doctors, we see so many issues. When you're walking around, you see so many issues. You see someone with a swelling over here. You see someone with, they are coughing and everything. We cannot intervene until you come to us. As otherwise it will just be gossip on the street. You'll tell me that I am judging you because you walk around with swelling on your forehead. But until you come to us and tell us, this thing has been disturbing me for this duration, can you help me manage it? That's the time we intervene. So even us as doctors, we cannot help you if you're not willing to help yourself. So we advise our viewers and the general population that your health is your own responsibility. So do those regular checkups, do those well-man, well-woman clinics, so that you do not land in greater problems down the line.
Thank you so much. To make this conversation continue, you can contact Daktari on 0727 863 or 0799 234 943. Thank you. It was a pleasure to have you. Your health, my health, is my personal responsibility. And of course, we have well man, well woman for us all, our dear viewers. Are you suffering from a certain disease? Please visit your nearest medical facility. There, pray, but also take action by visiting there. They do that medical checkup na itakusaidia sana 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 sana. I hope today's conversation was good to you, and I hope you have your takeaway home. Please, please, please do not let this knowledge just to yanguke tu chini potele. No, take action about it, and God is going to bless you, Na watu wa Roysambu na Kenya yote, at least we have a Christian medical practitioner. You can visit him, call him, and we can all benefit from what gift ama skill God has enabled to accumulate in the many years ambayo amekuwa in the medical field. God bless you. Thank you so much, Dr.
Thank you, sir.
Asante.
Thank you so much.